Hello friends, welcome to my channel, and in this video tutorial so let's talk about the migraine. So the migraine is one of the most important topic that we all have to know. It is actually, let's talk about the first of all about the facts. So migraine is basically a type of primary headache. So what is primary headache? So when the headache in which there is no underlying CNS pathology, यानी कि पर्सनलाई ब्रेन अंडरलाइङ पैथोलोजी केही पनि हुँदैन, यानी देयर इज नो एनी काइन्ड अफ ब्रेन डिजिज, देयर इज नो एनी काइन्ड अफ ब्रेन डिजिज, दो द पर्सन विल हैव द हेडेक, then that type of headache where the underlying exact cause is unknown, then in that type we would call that headache would be primary headache. If there, let's suppose if any person have a meningitis, and if the person is having headache due to the meningitis, then such a headache is secondary headache. But in the migraine, there is no underlying CNS pathology, there is no any infectious cause, or there is no any mass occupying lesion, though the person have headache. So such a headache in which there is no underlying CNS pathology, then we would call it as a primary headache. Now 1/3 of the headache which normally comes in the OPD are basically of the migraine headache. The first most common of the headache is tension headache, which we will discuss in later videos. In this video, I am telling you that the second most, not first most, the second most common of the headache are migraine headache, and basically the females are more prone than the males in this headache due to the basically hormone influence. As we know, the female have the hormone known as estrogen, so the estrogen has a role in basically it is seen that the prevalence of the migraine headache. So due to the estrogen, there is actually the migraine can be present. So not 100% the cause is related, but yes, there is somehow risks in the female. This headache usually occurs in the adult life or the middle age, and the pain of the migraine is basically also known as attack of migraine. Migraine को जुन पेन हुन्छ त्यसलाई basically attack of migraine पनि भन्छ. Another thing, the migraine pain, we will discuss the migraine pain in very detail. The pain of migraine usually localized to the one side of the head. Usually के हुन्छ, migraine को pain head को one side मा, either the right side of the head or the left side of the head. So person will tell you, I have the pain in the one side of the head, either right side or left side. And usually the pain, most of the time it is localized to one side, but it may be on both sides. But the pain may be on both sides. Another thing, the pain, intensity of the pain is moderate to severe. So the person will tell you that I have a very severe headache in the one side of the brain, and the duration lasts, the pain lasts for 4 hours to 3 days. So pain को के हुन्छ कि 4 घण्टादेखि लिएर 3 दिनसम्म पेन हुन सक्छ. अर्को कुरा, द पेन को जुन नेचर छ, सो इट इज अ भेरी लङ ड्युरेसन. इट इज हैन 4 घण्टा टु 3 डेज हुनु भनेको एउटा लङ ड्युरेसन हो. अर्को पेन, द नेचर अफ द पेन इज थ्रबिङ एन्ड पल्सटाइल नेचर. द्याट इज द पेसेन्ट विल टेल यु that the patient is having the pain like someone is beating with a hammer. So कुनै ह्यामरले पर्सनलाई हेडमा ब्लो गरेको जस्तो पेन फिल हुन्छ. पेसेन्टलाई लाग्छ कि कुनै ह्यामरले मेरो टाउकोमा ब्लो गरिरहेछ. सो त्यस्तो किसिमको टाइपको पेन हुन्छ इन द वान साइड अफ द ब्रेन, जुन पेन कि 4 घण्टादेखि लिएर 3 दिनसम्म पनि रहन सक्छ. ठिक छ. Another thing, the pain is actually associated with पेन भएको बेला मान्छेमा नोजिया र भोमिटिङ पनि हुन सक्छ. के हुन सक्छ? द पेन मे बी एसोसिएटेड विथ नोजिया एन्ड भोमिटिङ. पर्सनहरुमा पेनको बेला नोजिया र भोमिटिङ हुन सक्छ. अनदर थिङ, जति बेला पेन हुन्छ मान्छेलाई, द पर्सन विल टेल यु द्याट आई हेभ अ भेरी डिफिकल्ट इन टोलरेटिङ द लाइट. उसलाई घाममा और लाइटमा बस्न मन पर्दैन, ऊ चाहिँ शान्त बस्न चाहन्छ, उसलाई साउन्डहरुबाट इरिटेसन हुन्छ. द पर्सन विल हेभ इरिटेसन टु साउन्ड, इरिटेसन टु लाइट, हैन. द पर्सन विल गो एन्ड सिट इन अ डार्क रूम इन अ क्वाइट इन्भाइरोमेन्ट. सो लाइटमा जान इरिटेसन हुन्छ, लाइटले इरिटेसन हुन्छ, द्याट इज फोटोफोबिया. and they will also have irritation to the loud sounds, or in general talk also they will feel very irritated, that is phonophobia, and the pain may be associated with nausea, vomiting. So यो जति पनि features छ यो pain कै बेला हुन्छ, not that is before pain or after the pain. These features are simultaneously running along with the pain. That's why the patient want to sit in a dark room, हैन, डार्क रुममा एलोन बस्न खोजिरहेको हुन्छ पर्सन, एक्लै, ताकि साउन्डहरू नआओस् भनेर द पर्सन वान्ट टु सिट इन अ डार्क रूम इन अ क्वाइट इन्भाइरोमेन्ट. Another thing, the pain is basically, this pain is episodic in nature. Episodic in nature means यो pain को attack, let's suppose कि if you have attack today, then let's suppose this attack last for 4 hours. So 4 घण्टाको लागि तपाईमा यो attack भयो pain को, यानी तपाईले सबै कुरा भयो, and you have the pain in one side of the brain which was severe in nature, the throbbing pain, you have irritation to the light, irritation sound, you have nausea, vomiting, and now the pain lasts for 4 hours. And it may subside for a few days, few months, few years also. So pain एकचोटि पेन को अट्याक आइसकेपछि मान्छे केही वर्षसम्म और केही मन्थसम्मको लागि असिम्प्टोमेटिक पनि हुन सक्छ, हैन, and again the symptom may come. So the pain is not continuous that every day you will have pain. You may have pain once a week or once a month or once a year, हैन, that can be any. Frequency of episodes is not actually well defined, but the episode is very variable. But I have to say one thing, that the pain is basically episodic in nature. So this is basically how the migraine pain looks. And the last thing, that the pain usually aggravates on walking or exertion. So let's suppose if you are on the time of attack, तपाईले अहिले attack भइराछ, and now if you will walk or if you will do any exercise or if you will do any kind of work, then the pain may aggravate, हैन. So the pain को यो नेचर छ कि pain चाहिँ walking or exertion सँग aggravate हुन सक्छ, यानी बढ्न सक्छ. Now let's study the stages of migraine. So in stages of migraine, basically we have the first stage, we will talk about the prodromal stage. So prodromal stage is a stage that is 1 to 24 hours before the pain. So पेन हुनुभन्दा 1 देखि 24 घण्टा अगाडि नै द पर्सन विल गेट नो द्याट मलाई अब 1 देखि 24 घण्टा पछि पेन हुन सक्छ. एन्ड 1 देखि 24 घण्टा अगाडि के फिचर्स लिएर आउन सक्छ कि द पर्सन विल ह्याभ अ चेन्ज इन मुड, आइदर द पर्सन विल ह्याभ डिप्रेस्ड मुड or irritable mood, or the person may have the illusion. The person may tell you that he has a frequent yawning 1 to 24 hours before the pain start, and he may get some craving for some special kind of food, that may be anything. So कुनै पनि food को लागि person लाई craving हुन सक्छ 1 to 24 hours before the pain, and the person may tell you that I have a very thirsty feeling and now I may get the pain. So यो prodromal stage भनेको pain हुनुको 21 to 24 hours भन्दा पहिला केही फिचर्सहरु हुन्छ जुन हामीले अहिले डिस्कस गर्यौं. सो यस्तो सिम्पटमहरु आयो भने पेशेन्ट will already know that I may get the pain or the migraine attack in few hours. Once the prodromal stage is over, then the person will have the attack. The person will be in an attack or pain phase. So attack or pain phase ma huncha. Sorry, I mean to say that the person after the prodromal stage, once the prodromal stage is finished, then the person may be in the aura stage. So there is another stage known as aura stage that will come after the prodromal stage, and it will come before the pain stage. So pain आउनु भन्दा अगाडि र prodromal पछि चाहिँ जुन स्टेज आउँछ त्यसलाई aura भनिन्छ. That will not be seen in every patient. Only 30% of patient have this stage. So सबै पेशेन्ट मा चाहिँ aura stage हुँदैन. 30% of the patient will tell you about the aura stage. So जति पनि migraine मा patient आउँछ त्यसमा 30% patient will tell you that I have aura. So what are the features of aura? So aura ma के हुन्छ? So let's talk about aura. So first of all, you have to know that only 20 to 30% of patient of migraine will have aura. So only 20 to 30%. It's not most common. That is most common that the person is not having aura. So most common के छ कि patient लाई aura हुन्न. तर अर्को most common तर त्यसपछि 20 to 30% patient मा aura हुन पनि सक्छ. The aura can be two types. That aura can be two types. One is a visual aura and another is a sensory aura. So what is visual aura? So the person will tell you that he has fortification spectrum. That is, he will tell you that he is looking any zigzag lines in front of eye. So उसले के भन्छ कि म आफ्नो आँखाको अगाडि zigzag linesहरू हेर्छु. This zigzag lines जुनले आँखाको अगाडि हेर्छ पेन आउनु भन्दा पहिला, that is known as fortification spectrum. अर्को, the person may tell you that he has scotoma. Scotoma means before the pain begins, he will tell you that he is seeing any blind spot in his visual field. So visual field मा कुनै blind spot देख्नु भनेको scotoma हो. So blind spot in visual field. So visual field मा any dark seeing area or any blind spot is known as scotoma. Fortification spectrum means zigzag lines. So zigzag lines in front of eye. Front eye आँखाको अगाडि यदि zigzag lines जस्तो देखिरहेछ भने that is fortification spectrum. आँखाको अगाडि यदि जुन visual field छ त्यसमा कुनै black mark or black patch देखिरहेछ, blind spot देखिरहेछ भने त्यसलाई स्कोटोमा भन्छ. आँखाको अगाडि कुनै flashlight बाले जस्तो लाग्छ भने that is transient flashes of light. So these kind of features the patient will sense just before the pain. So pain आउनु भन्दा केही बेर, either few minutes before, not like prodromal symptom कि 1 देखि 24 घण्टा पहिला. Prodromal हेर्नुस्, prodromal symptom come 1 to 24 hour before the pain, but just before the pain aura आउँछ. त्यही भएर पहिला prodromal, त्यसपछि aura, त्यसपछि pain. र aura आउने बित्तिकै पेशेन्ट विल नो कि मलाई अब चाहिँ माइग्रेनको अट्याक आउने वाला छ, हैन. तर यो aura सबै पेशेन्टमा आउँदैन. यो only 20 to 30% will have the aura. And यो जुन aura भने all related to vision, so known as visual aura. There is another aura known as sensory aura. So this sensory aura, that person will tell you that he has numbness or tingling sensation is in hand. Numbness or tingling sensation in his hands. So हातहरुमा खुट्टाहरुमा चाहिँ numbness, tingling sensationहरु आउन सक्छ before the pain begins, and such a kind of aura is known as sensory aura. So the person ma sensory aura is very less common, but more common is visual aura. So I have already discussed about aura, हैन. So while talking about stages, the first stage was prodromal symptom. Then the person may have aura or may not be present, so it is plus minus. Then there will be pain stage, that is the attack phase, which may last for 1 hour to 72 hours. And then there will be a stage of, so pain को बारे हामीले already कुरा गरिसकेका छौं. Then there is a stage of resolution. जुन resolution stage मा चाहिँ मान्छेको चाहिँ अब pain attack हरु subside हुन्छ, and the person will feel the hangover, like जस्तो रक्सी खाएको जुन hangover जुन के भन्छ blackout हटिसकेपछि the person will suffer a kind of hangover. So त्यस्तो hangover चाहिँ last stage मा देखिन्छ, which is not so much important stage. So basically you have to know about these first 3 stages, and I have already discussed in great detail about first 3 stages. So while talking about the cause of migraine, the exact cause is unknown. So it is very uncertain that what is the exact cause of migraine. So it is seen that if there is any family history, then it is very common. And a very little knowledge on this migraine, that it is related to the dysfunctional ion channel of the neuron. So neuronहरुमा जुन ion channel हुन्छ, and if that ion channel is dysfunctional for a period of time, like that, if first of all there is a cortical depolarization, that is a neuronal depolarization occur, and followed by the hyperpolarization. Depolarization means first of all the neuron excites, and then the neuron depresses. पहिला neuron excite हुन्छ, त्यसपछि depress हुन्छ. र यो एक्साइटेसन डिप्रेसन को बेरमा चाहिँ मान्छेलाई माइग्रेन भइरहेको हुन्छ. इट इज अल्सो नट 100% एप्रुभड कि यही हुन्छ भनेर. इट इज जस्ट अ फ्यू कज, हैन, जुन माइग्रेनले भन्छ. एन्ड सो एक्ज्याक्टली हामीले माइग्रेन यही कारण हुन्छ भनेर भन्न सक्दैनौँ, बट यस देयर इज सम ट्रिगरिङ फ्याक्टर्स or some precipitating factor that may lead to the migraine attack. So let's talk about that. So the triggering factors are basically the sunlight. So if a person will tell you that if he goes in sunlight, then he is having the more pain or the attack may precipitate. So यो केही फ्याक्टर्सहरु छ. यो फ्याक्टर्सहरु प्रेजेन्ट भयो भने मान्छेलाई त्यो अट्याक आउन सक्छ और भएको अट्याक एग्राभेट हुन सक्छ. सो द ट्रिगरिङ फ्याक्टर्स आर सनलाइट, स्ट्रेस, कुनै कुराको स्ट्रेस लिने, चिन्ता लिने, और त्यो कुराबाट तनाव आइहाल्ने, एन्जाइटी हुने, और एक्सरसाइज गरेर हुन सक्छ, और हेभी वेट लिफ्टिङले हुन सक्छ. Insomnia or any sleep disturbance, if he is not having the good sleep in the night, then he may have the migraine attack. Or if he is taking excess of coffee or any tea, then excess amount of caffeine can cause the migraine attack. Another thing, the travels. So if he is traveling more without any taking rest, then the migraine attack can precipitate. Or if the person is fasting or overeating, then this attack may come. And if he's taking chocolates, red wine, cheese, then यो कुराहरूले पनि के गर्छ त migraine attack हुन सक्छ. Another thing, if there is a high temperature, so in a very sunny day, if there is a high temperature, then the person will have excess sweating, and that may also can cause the migraine attack. So यो ट्रिगरिङ फ्याक्टर्सहरु जसले चाहिँ माइग्रेन एट्याकलाई एग्राभेट गर्न सक्छ और भएको एट्याकलाई चाहिँ त्यही बढाउन सक्छ और एट्याक ल्याइदिन सक्छ. सो यो फ्याक्टरहरु हुन सक्छ र दे आर नट कज बेसिकली. So let's talk about the investigation. So investigation is basically the clinical based on the clinical diagnosis, that is on the basis of history, but you may go send the investigation for the CT scan or MRI of the brain to rule out any pathology, maybe any tumor or any other secondary causes. Rule out गर्नको लागि तपाई CT scan or MRI गर्न सक्नुहुन्छ. But usually the investigation is based on the clinical diagnosis and the history. Another thing is कि जुन यहाँ migraine को जुन pain हुन्छ, if that pain occurs more frequently, let's suppose of 3 or 4 times in a month, so एक महिनामा 3-4 चोटी pain को attack आउँछ भने such migraine is already actually included under the chronic migraines. So यदि migraine को attack एकदम frequently आउँछ, month मा चाहिँ 3-4 चोटी आउँछ, त्यो भन्दा बढी आउँछ भने we will call it a chronic migraine. And the treatment approach for the is different for the acute migraine and a chronic migraine. So if you have the very symptom of the chronic migraine, तपाईले धेरै frequently symptom आउँछ भने the treatment modality is different. And if you have the acute symptom, let's suppose कि occurring once in a year, then the treatment modality is different. So let's talk about some preventive measures that if the person is having migraine very frequently, then you may say a patient, the doctor may tell a patient that you may make a diary log. So in that diary log, you will basically mention that after what triggers the pain will get precipitated, and we will first locate that what are the triggers, what basically causes you the pain attack, what were you doing just before what are the aura, and त्योहरु मेन्टेन गरिसकेपछि you have to avoid those triggers. So आफ्नो ट्रिगर पत्ता लगाउनु, त्यसपछि त्यो ट्रिगरहरुलाई एभोइड गर्ने. सपोज if you are having the migraine attack just after going sunlight मा गएपछि यदि attack हुने चान्स धेरै छ or attack एग्राभेट भइराछ भने you should prevent from going to sunlight, or you should wear umbrella. So that kind of measures can be used. So these are preventive measures. And basically for a chronic type of migraine, or if the migraine symptom is very severe, then you may go for the prophylactic medications. So it's a preventive medication or prophylactic medication हामी use गर्न सक्छौं, and they are basically I will first write about the groups. The groups are basically antidepressant. So the antidepressant हरुले राम्रो काम गर्छ against the chronic migraine. This can be used. Anti-anxiety medication can be used. Anti-anxiety medication, and as we know in a cause that there was a excitatory CNS activity, that's why anti-convulsant medicine can be used. And there is another medication known as piezotifen. So piezotifen also can be used. So your antidepressant, anti-anxiety, anti-convulsant, piezotifen can be used in the prophylactic medication, the chronic migraines. अब attack आउनु भन्दा पहिले they should take these things in a daily basis, so that there will be the very less severe attack, or the attack frequency is decreased. So the antidepressant may be tricyclic antidepressant, basically the amitriptyline or the sertraline. Anti-anxiety medication like such as propranolol, this is beta blocker, and anti-convulsant like as valproic acid. So अरु पनि ड्रगहरु छन् यो सबै क्लासमा. सो मैले जस्ट एउटा दुईटा ड्रग भन्दिए हजुरहरुलाई, हैन, and antidepressant and anti-anxiety and anti-convulsant basically used in the frequent attack person or the person having the chronic migraine. For the acute attack, you may give the simple analgesic, aspirin, paracetamol or diclofenac. And if the attack is a little bit severe, then you can combine the analgesic and triptans, basically the sumatriptan, the rizatriptan, the nuratriptan. आजकल नुरा फतेही हिरोइन एकदम फेमस छ हैन. सो नुराट्रिप्टेन पनि एउटा औषधि छ. सो नुराट्रिप्टेन हैन. You can remember that नुडा फतेहीलाई माइग्रेन भएको होला हैन. For the vomiting, there is a metoclopramide, domperidone, and prochlorperazine. So these are the drugs for use can be used for the vomiting. These are the drugs for the use for the acute attack of pain. But you have to know that these medications after the certain time they will itself will be the cause of headache. एउटा के भन्छ कि यो मेडिकेसन्सहरूले एउटा टाइमसम्म मान्छेले काम गर्छ, तर धेरै मान्छेले यदि फ्रिक्वेन्सी बढिरहेको छ भने यो मेडिकेसन्सहरूले झन् पेन बढाइदिन सक्छ. सो त्यति बेला यदि यो मेडिकेसन्सहरूले पेन उल्टै मेडिकेसन बढायो भने पेन, देन दिज आर नोन एज मेडिकेसन ओभरयुज हेडेक. मेडिकेसन ओभरयुज हेडेक. So initially, if you give the patient simple analgesic or triptan, they will work very good. Very good results. The person will have the pain subsided in the initial stages. But if the frequency increase, if the person is chronic migraine patient, then these medications will aggravate the pain, and that is known as medication overuse headache. Since this migraine is more common in female, then you can tell the female to avoid the use of OCP. So if she is using the oral contraceptive pills, then she may avoid, or if he is taking any form of the hormonal contraceptive, then she need to avoid that hormonal contraceptive to get rid of this pain. So this was all about the migraine, and I hope you like my video. So thank you so much for watching us, and thank you. Subscribe my channel.